Alrighty. Hello, everyone, and welcome to the latest in public health research. Hi, Monique, with your camera on. Thanks for, for putting it on so Carly can see you there. I hope everyone is keeping cool today. That's going to be important. If you're wondering, over here in Berkeley Way, it is much more pleasant than it is at my house, for example. So if you need somewhere to hide, this might be it. So our speaker today is Carly Hyland. She's an assistant professor in environmental health sciences, and she does exciting work on how to mitigate the health effects of climate change among our agricultural and food systems workers. I'm really excited to see Carly's presentation. I'll hand it over to her.
Awesome. Thank you so much. So I will go ahead and share my screen. I do have a bit of a cold, but luckily not COVID or the flu. So I think we'll make it. Yeah, so I'm an assistant professor of cooperative extension with UC Agriculture and Natural Resources. And I'm housed here in environmental health sciences in the School of Public Health. And so what that really unique position pretty much means is that I'm charged with doing both research and outreach related to both characterizing and mitigating the health impacts of climate change among agricultural and food systems workers. And so I'm going to talk with you today about specifically the AgPass program in Sonoma County and farm workers working during wildfires. So as a bit of background, there is an assembly bill that was unanimously passed by the legislature and signed by Governor Newsom in 2021 that essentially allows owners and ranchers and operators with livestock to re-enter fire evacuation zones or evacuation zones for some other emergency in order to, rescue their livestock. And so this program is really intended for producers and managerial level employees with working knowledge of ranches to be able to re-enter that zone during emergencies to save the livestock. And this has really paved the way in recent years for an ag pass. And I will note that California did try and pass a specific ag pass and it did not pass. Right now, at a state level, we only have this livestock pass specifically for ranchers and livestock. So in Sonoma County, from 2017 to 2022, there had been kind of an ad hoc ag pass program in which if there was an evacuation zone ordered due to a wildfire, the ag commissioner was kind of issuing temporary ad hoc permits for employers and employees to be able to re-enter the zone. And these were used in fires such as the Glass and LNU Lightning Complex fire. In 2022, the Sonoma County Board of Supervisors officially approved an ag pass program. So it was no longer kind of this ad hoc process, but they officially approved a program using authorizing language in AB 1103. Again, notably, AB 1103 was specifically a livestock program. However, the language didn't explicitly exclude agricultural workers. And so the Sonoma County Board of Supervisors is using language from AB 1103 as authorizing language for their county ag pass program. And this allowed farm workers to re-enter evacuation zones for what they considered critical activities, including irrigating crops. And it really granted the sheriff full discretion to interpret and implement the program. And then in 2023, in September, just over a year ago, the Sonoma County Board of Supervisors amended this program, which had never actually been used. Luckily, in 2022, there were no fires. And so the Ag Pass in its current form had never been activated, and they amended the program to officially include harvest. And so agricultural workers are now allowed to re-enter evacuation zones for activities, including irrigation of crops, harvest, and other activities. So the process for applying for an ag pass: first, an employer or operator of a commercial entity has to apply to the agricultural commissioner's office. And if they want their employees to be able to have an ag card, then employees individually need to apply as well. So both owners, operators, and employees have to complete a fire safety training. You then apply for the program through the agricultural commissioner's office. And if that application is approved, you go to the sheriff's office and have to get kind of a driver's license style ID card that you can see here. So this information includes the name of the card holder, a picture of the employee, and the name and address of the commercial operations that the card holder can access. And so the idea behind this program is essentially, employers and then employees can apply for the program, again, through the Agricultural Commissioner's Office and then the Sheriff's Office. The data and the applications are stored at the Sheriff's Office, and employees have to go to the Sheriff's Office to get their picture taken. If there is a wildfire or really other emergency event, the Sheriff's Office can declare an evacuation zone and everybody must evacuate. And then the sheriff, if they deem it to be safe, can activate the Ag Pass program, which allows Ag Pass holders to go back into these evacuation zones. And so essentially then at the evacuation zone, an individual would show their card to the law enforcement entity at the evacuation zone. This may be the sheriff, or it may be other entities such as California Highway Patrol, and then they would be allowed to enter that specific zone to enter a specific operation. So this is really incredibly important to understand the potential implications of this program. Many of us here living in the Bay Area know firsthand how destructive many of the wildfires in Sonoma County have been in recent years. So you can see some of them listed here. In 2017, the Tubbs fire was the most destructive at the time, and it's just like every year that's a small fire now compared to what we're experiencing now. And additionally, there's really widespread evidence, of course, that wildfires are associated with increased emergency department visits, inpatient admissions, asthma medication prescriptions, etc. And there's really consistent evidence that these increases in adverse respiratory outcomes have disparities by race and socioeconomic status. However, there's still not really much data on farm workers and those who are actually working outside. And if you think about it, when the AQI is bad, one of the very first recommendations we are given is to stay inside, and that's not helpful for those who work outside and are being exposed to very high levels of wildfire smoke. And so I was very lucky about a year ago to meet with the Human Rights Center, who had started an evaluation of the Sonoma County Ag Pass program. And their goal was really to examine the health, physical safety, economic security, and data privacy of farm workers in relation to this county program. And I came on board really to help with the health assessment here. And so that's mostly what I'm going to be focused on today. And our overall goal of this project is to conduct a law and policy analysis of this county program and kind of AB 1103 that kind of paved the way for this program, conduct a health survey, and then develop recommendations both for the county and state of California to increase protections for farm workers. So I'm going to talk first about the health survey. And again, this is really kind of where my biggest level of involvement has been. So pretty early on, I met with a farm worker advocate in Sonoma County named Zeke Guzman. He's shown in the right side of the screen there. And he, when I first heard about this program and agreed to sign on with the Human Rights Center to help out with the health aspect, I was like, okay, maybe we can get surveys of 100 or 200 farm workers. And he was like, no, I think we should do 1,000. I was like, okay, if you say so. And he truly made it happen and really suggested that we hire a community engagement team. And so I hired him and 6 other individuals who, have ties with farm workers in the community and are just really trusted entities, which is just so important in this population that understandably has a lot of fear of, various different entities, including academic organizations. And so I hired this team with ties to, different health clinics and nonprofit organizations in the area, and also just, those who had worked in like census outreach, et cetera. And then I also hired a really excellent team of mostly Berkeley undergraduate students who helped on the project. And so essentially what we did was recruited participants from pretty much March to June. There was a lot of kind of personal outreach from the community engagement team in Sonoma. And we also advertise the survey at different farm worker housing units. There's a lot of farm worker designated apartments in the Sonoma County. Also at churches, and again, kind of just snowball sampling and word of mouth through the community engagement team. And so we would go up on weekends mostly and administer surveys verbally to participants. And the surveys assessed both their understanding of the Ag Pass, and then also, regardless of whether it was officially under an Ag Pass, their experiences working in agriculture during wildfires, who farm workers considered to be trusted sources of information and training, any services or resources they would like to have if they were to work in agriculture during wildfires in the future moving forward, and also economic concerns that they had. And so we did complete just over 1,000 surveys with farm workers. The population was about 60% male. The average age was 41 years, and the average experience in agriculture was almost 13 years. And you can see here, participants could select multiple areas where they worked, but you can see we really did get quite a wide distribution of work kind of all around the county. We found that of the over 1,000 people who took our survey, only 8.5% had ever heard of the Ag Pass, and only 2.2% have signed up for the Ag Pass. And remember, according to the county at this stage, if one is to re-enter an evacuation zone for a fire, they are supposed to be signed up for this program and have this pass. When we asked individuals kind of, what challenges they had signing up for the Ag Pass, or if they had heard of it and hadn't signed up, why not? The most common responses we got were, that it was difficult to find information about the program. Even if they could find information, it was really hard to understand or wasn't in their primary language, and hesitancy to interact with the sheriff or get their picture taken to enroll in the program. And like I said, we also asked individuals about their experiences working during wildfires. So about 75% of the study sample had previously worked in agriculture during a wildfire. Of these, about 64% had received some sort of PPE from their employer. But about 40% of those had to reuse their PPE. So this was one of our really big concerns, that, they weren't necessarily getting fresh PPE throughout the fire event. And many reported that the masks that they were getting were not N95s and were just kind of the surgical masks that really don't protect against wildfire smoke. About 70% of the population that had worked during a wildfire experienced short-term health impacts, such as headache, sore throat, cough, shortness of breath, eye irritation. And among those, 36% experienced chronic impacts that, continued to persist over time. And nearly everybody indicated that they were concerned about the health impacts of exposure to wildfire smoke if they were to work in agriculture during a fire moving forward. And when we asked individuals who had experienced health impacts from the wildfire smoke, what barriers they experienced in accessing healthcare, some of the most common responses were not having healthcare, and this is notable. Recently, Medi-Cal was expanded to cover undocumented workers, but there's been a lot of hesitancy in undocumented workers signing up for the program, so there's been pretty slow rollout there. Another thing that was really big was that it was really difficult to get an appointment at the clinic because they were so slammed. A lot of the clinics are, in more populated areas, and for those working in more rural areas, it was really difficult for them to get there. And so, in addition to this health survey that we did with farm workers, we also did a lot of kind of key informant interviews with different stakeholders throughout the process, including the County Board of Supervisors, the Agricultural Commissioner's Office, the Sheriff, the Department of Health, etc. And stepping back, one of the big key pieces that I've taken away from this is that there is no consideration of short or long-term health impacts when the sheriff is deciding whether to activate the Ag Pass. They are taking into consideration the immediate physical safety. So for example, they have indicated that they wouldn't activate the Ag Pass if there were a red flag warning, but there's really not any consideration of what it means for short or long-term health. And as I said, they won't activate it if there's a red flag warning, but they don't really have any other criteria to guide, when it could or could not be activated. And during and following a fire, there's no health monitoring. And as we saw, a lot of farm workers have experienced health impacts and are concerned about the health impacts of wildfire smoke. So now I want to talk a little bit about economic security, because it was clear, even before starting the survey, through conversations with the community engagement team and throughout the survey, that there is such a tension between health and economic security. And so at baseline, individuals are spending approximately 50 to 75% of their monthly income on rent. And so we just heard so overwhelmingly, if there's a natural disaster such as a fire or floods or whatever it may be, and individuals can't work, it's extremely difficult for them to pay for basic needs. And so nearly everybody indicated they would be very worried about lost income if there were a wildfire and they couldn't work. And of those who have worked in a wildfire, 58% agreed with the statement, "I felt sick, but I continued to work because I couldn't afford to lose income." And 51 agreed, "I felt sick, but I continued to work because I was afraid of losing my job." And again, then when we look at those, specific needs, we asked individuals, if there were a wildfire and you lost income because you couldn't work, would it be difficult to pay for these certain items? Almost everybody said it would be very difficult to pay for rent, and other items included groceries, gas and utilities, medicine, and healthcare. And then briefly, I'm going to talk a little bit about data privacy. So we asked farm workers who took our survey, who would they feel most comfortable interacting with to get information about the AgPass program and also get, training. And overwhelmingly, unsurprisingly, they indicated entities such as community organizations, local health clinics, or a farm worker resource center, which does not exist in Sonoma County right now. And notably, they had the lowest amount of trust or comfort in the sheriff's office, again, who is really responsible right now for running this program, and still pretty little trust in the agricultural commissioner's office, as well as the Department of Emergency Management and Department of Public Health. And one of the big takeaways for me regarding safety is that right now there is no process by which to communicate with individuals re-entering an evacuation zone. So if I'm a farm worker and I'm, re-entering this evacuation zone with my AgPass, there's no plan or process to communicate with me while I'm in that zone. And it's also entirely on the employee to ensure, or sorry, the employer to ensure that the employee has left the zone. There's no, monitoring to make sure that everybody who has entered the zone has also come out. The sheriff does have the ability to request this information from employers, and notably the AgPass was activated very briefly for a relatively small fire in June 2024, the Point Fire, and the sheriff did not request this information at this time. So essentially, there's really no process to track people coming in and out of the zone and ensure that they're safe, or communicate with them if situations escalate and they need to evacuate the evacuation zone. So the stage that we're at right now, we finished a lot of our research and interviews with different county and state stakeholders. And right now we're holding community forums to present the results of our survey and analysis, and also present our recommendations and solicit feedback. And so we held last Sunday, a little over a week ago, our first community forum with farm workers at a church in Cloverdale. So you can see my two absolutely extraordinary undergrads working on this project, Montserrat and Daphne, who really led a lot of the presentation of the findings and recommendations. And then on the right, you can see after the forum, the full community engagement team, Human Rights Center representatives, and other students working on this project. So we will have 2 more forums specifically for farm workers and community-based organizations that serve farm workers. We're intentionally holding these kind of closed sessions to try and ensure that farm workers feel comfortable both attending the forums and also speaking up and sharing their perspectives and opinions during the forums. And you can see in the bottom right picture there, we had tamales at the first forum, and we'll have them at the remaining to kind of try and create a comfortable environment. And then we'll also have 3 public forums that are totally open to, anybody who wants to attend. We have specifically advertised them to a wide range of entities, such as each of the 5 members of the Board of Supervisors in Sonoma County, the Agricultural Commissioner, the Sheriff, different CBOs, industry, really everybody across the spectrum. And again, the goal is to get feedback both on the recommendations and also the feasibility of implementing our recommendations, because we really want to ensure that, they could actually be used on the ground. So now I'm just going to briefly talk about some of those recommendations. I want to note that, this is all really preliminary work at this point. We've just had the one session with farm workers so far. And really the biggest feedback we heard at that session is that they would not feel comfortable interacting with the sheriff's office to sign up or enroll for this program. But we have not yet had any of these public forums, and so the whole goal is that these recommendations will, change and take shape after we get more feedback. But I just kind of wanted to present kind of a high level here, because I'd also love to hear, feedback from all of you with your different areas of expertise. So kind of some overall recommendations is, right now, the process to sign up for the Ag Pass is you apply through the Agricultural Commissioner and then have to go to the sheriff to get your picture taken and get this ID card. And we're kind of wondering if perhaps that process could be consolidated. So, perhaps individuals are just going to the Agricultural Commissioner for this whole process. That minimizes the number of offices that have access to, the application and personal information. And the language in AB 1103, which again is that livestock pass program, kind of explicitly calls out the Agricultural Commissioner or another entity. And so it kind of, would be intuitive that the Ag Commissioner would be an entity that could be responsible for this. Overall, we also recognize the need to conduct additional research specifically into the particular vulnerabilities of H-2A workers. So the H-2A program is a program by which, if agricultural employers in the United States don't feel that they have enough labor, they can hire workers predominantly from Mexico. The H-2A visa program is almost exclusively in Mexico to come work in the United States seasonally. This program has, it's well documented that H-2A workers have a lot of extra layers of vulnerability and even increased fear in speaking up over concerns and fear of retaliation. And so even though we had this really extraordinary community engagement team that had ties with the community, and they talked with a number of H-2A workers about participating, nobody felt comfortable in participating in the survey, even though it was completely anonymous. We were not collecting any identifying information. And so it's really important to understand what are those extra layers of vulnerability. And notably, we talked to a number of county officials who were not able to tell us if H-2A workers are eligible for the Ag Pass program or not. Previous work by an organization called North Bay Jobs with Justice has found that 1 in 3 individuals working in ag in Sonoma County speak an Indigenous language. And we didn't get as great representation of Indigenous language speakers in our survey. And so I think there is more research needed into the specific needs of Indigenous language speakers, especially, if those primarily speaking Spanish said that the information about the Ag Pass was difficult to understand. It's just going to be even greater in Indigenous languages, especially as many of those are spoken and not written languages. That should say area monitoring. I'm really interested in understanding more about farm workers' personal exposure to wildfire air pollutants, such as particulate matter, using both personal and area monitoring. I think a lot of this conversation has come down to this black and white situation of whether it's an evacuation zone or not. And the truth is that there are a lot of conditions when it's not a formal evacuation zone in which the air quality is very poor. Again, as we know very well here in the Bay Area, when there are big fires in Sonoma, we get really poor air quality here. And so we need to do more work to understand what are those exposures and how do we protect workers? And then we also heard from workers about the need for more financial literacy classes, kind of both understanding what are the resources available for workers, especially if there is, a climate event and work is not available. Are there resources for them to access to be able to meet these basic needs that I discussed earlier? So for the health recommendations for the county, really one of the biggest ones almost immediately for me is that an entity such as the Sonoma County Department of Health really should be included in decisions about whether to activate the Ag Pass and be tracking, AQI in the evacuation zone and surrounding areas, as well as heat levels. I also think, we heard really clearly that organizations such as community-based organizations, federally qualified health centers, and community health workers are the most trusted entities, and the individuals want more information and want more training. And so I think it would be really great if the county could formally partner with these organizations, and there is kind of an existing infrastructure there to deliver trainings on the effects of wildfire smoke, how to protect yourself, and also know your rights trainings. And also partner with these organizations to distribute personal protective equipment to farm workers and really do this proactively rather than when a fire happens, then trying to start to get all of the PPE. And this recommendation really came primarily from Zeke, the farm worker advocate, is delivering safety kits when employees sign up for the Ag Pass. So this could include some N95s, information about the hours and locations of local health centers, contact info for community-based organizations, Cal OSHA and other organizations, if employees do have a concern or question that they want to file. And then this is something really that in practice is kind of already required, but ensuring that employers have kind of a sufficient stockpile of PPE for workers so that they're able to distribute that at the workplace if there is wildfire. And then also looking at the feasibility of expanding health services and monitoring during and after wildfire events. So there is one clinic in the area that is applying for right now a specific designation as a farm worker clinic, and that would come with additional funding and resources. And so evaluating kind of the feasibility of expanding specific farm worker health clinics in the area, as well as perhaps expanding mobile health clinics and other ways to reach farm workers in a way that's convenient to them to make sure that they have access to health screening and services. And then at a state level for health, again, right now, you to sign up for the Ag Pass have to complete this fire safety training. But again, there's nothing about health included in that training. And so one of the recommendations is to work with an entity such as the California Department of Public Health or county health departments to include information about the health effects of wildfire smoke and how to protect yourself for anyone who wants to sign up for this program. I also think personally, there's a need, even though this just happened in 2019, for Cal OSHA to update its smoke standards. So right now, I'm seeing some support from Monique there. Right now, the current thresholds are basically that PPE must be made available if the AQI is 150, and it's not required to be worn until the AQI is 500. And if any of us can imagine working outside, with the AQI above 150 without a respirator, that's insane. And right now there's no thresholds at which it's considered too dangerous to work. We have heat regulations at which there are different thresholds in which, breaks are required at a certain heat level. And then at certain levels, I believe we need to agree that it is just too dangerous for workers to be working outside. And, current AQI thresholds are developed for healthy and sensitive groups. So perhaps this threshold could be developed that way as well. And then increasing monitoring for health symptoms after smoke events. Washington has implemented this in their smoke law, as well as requirements for employers to communicate AQI levels in an accessible manner to employees. And then also, this is something that's been really well addressed by other organizations, and so I'm kind of just lifting up the work that others, such as the California Food and Farming Network, have published in addressing barriers in the enforcement of current Cal OSHA regulations and the ability for farm workers to report concerns. In regards to physical safety, as I said, there's no method right now to communicate with workers entering an evacuation zone. So essentially developing that method and developing some sort of method to ensure that those who have entered the evacuation zone have safely left. There's a really great example from Ventura County and a collaboration with CAUSE, which is a CBO in Southern California that provides notifications of air quality levels in English, Spanish, and Indigenous languages as both text and audio notifications. And so I think a similar system could be developed here. And this is a recommendation that really came from the Human Rights Center, also making sure that there is an alert system when the Ag Pass is activated or deactivated, because right now there's not really widespread information about where is the evacuation zone, where are workers technically allowed to be working versus not. And one really big thing we've heard with a lot of stakeholders about this is that there is a lot of employer provided housing across Sonoma County. And so if there is an evacuation ordered in a certain area and they haven't evacuated the area because they didn't know that they were supposed to, they're not getting the alerts. We've heard anecdotally that individuals have been pressured from employers not to evacuate an area. They may be continuing to work without this formal Ag Pass. And so there just needs to be more notification and information about this system. And then for economic security, there's, again, this organization, North Bay Jobs with Justice, that has been doing some really wonderful work on looking at both hazard pay and disaster insurance. And so just kind of wanted to point out the incredible work that they're already doing. And so they've gotten some vineyards in Sonoma to provide hazard pay, which is pretty much that if the AQI is 150 or above, workers get paid time and a half. And then they've also worked with 2 vineyards in Napa to kind of voluntarily sign up for disaster pay, which includes both this hazard pay with the AQI level, as well as if workers decide that it's too dangerous for them to work, they continue to get paid their normal salary. Just this week, SB 1105 passed, which increased the amount of sick days for agricultural workers from 3 to 5 days, and also allows workers to use climate emergencies. So if there's a declared state of emergency due to a fire or flood, I'm seeing not a lot of enthusiasm from Monique on this one. If there's a climate emergency due to something like a fire or a flood, workers can, in theory, use that as one of their 5 sick days. I think 5 sick days is not very much. And 2, I think there are still a lot of remaining questions about, okay, well, how in practice, if I'm a farm worker, do I actually say, I want to use this as one of my 5 sick days because there's a fire today. And there are a lot more than 5 days where there are climate related emergencies in a lot of these areas. And then I think at a state level, a lot of people are looking at expanded unemployment and specifically a safety net for all, which would expand this disaster pay and disaster unemployment insurance to undocumented individuals. This has now kind of been reduced to a study bill that would essentially study how an organization such as the California Employment Development Department would be able to administer a program like this for undocumented workers. And then in terms of data privacy, a lot of what the Human Rights Center is working on is developing a policy. Right now, there is no policy. So only collecting information from workers that's strictly necessary, clearly outlining the entities that data could be shared with and why, and the security of the data storage. One thing that we heard from stakeholders really across the spectrum is concerns over data privacy. So for those who are really in support of farm worker rights, there are a lot of concerns that entities like ICE could access this data. For those who are working more on the industry side, we heard concerns that if a worker signs up for this program through a public entity, that information is then subject to a public records request, and there's fear that that could be used for unionization efforts. And so really kind of concerns across the spectrum on this one. And then I just wanted to mention, you know, I'm working with a really great team on the Human Rights Center on this project who understands law and policy in a way I simply do not. And so that's been really, really fantastic. But I would love to continue to kind of expand public health partnerships here. So again, one thing I mentioned earlier is looking at personal and area monitoring to understand exposures inside and outside of evacuation zones, and ideally coming up with AQI thresholds and, you know, policies where we can agree that it is safe or unsafe for individuals to be doing manual labor outside. I'm also really interested in working on interventions. So one thing we heard from workers also is that a lot of them, you know, feel that smoke can enter their homes if there's a wildfire, but very few had air filters in their homes. So perhaps an intervention to increase air filtration devices. Another thing that we heard is, you know, the number one recommendation if there's a wildfire is to stay inside. As we discussed, that's not really reasonable for those who are employed with outdoor occupations. And then the next recommendation is to wear an N95. And as we all know, N95s are not particularly comfortable, especially for an 8-hour shift, again, where you're doing manual labor. And so I think increasing both information about why N95s are important to perhaps, you know, encourage the use of N95s, particularly when the AQI is really bad. And then also perhaps testing out different N95s to maybe see if there are some that are more comfortable for certain workers versus others. And then this last one is one I've talked with some folks in HPM about a little bit, but I think, you know, it would be really great, as I said in one of the very first slides, we know that hospitalizations and emergency department visits and inpatient visits increase following wildfire events, but right now we don't really have that data specifically for occupation and for, you know, farm workers or also landscapers and others working outside. And so I think having this information would be really helpful to show, you know, disparities in this population. And with that, I would be very happy to take questions. I'll stop sharing so I can see all of you.
Great. Thank you so much, Carly. That was really fantastic. I learned so much, and thank you for that amazing work you're doing. Yeah, please raise your hand if you want to ask a question, or feel free to put a question in the chat.
You see that Betsy shared federal regulations for workplace exposures to particulate matter are still higher than 500 AQI.
And thanks, Monique, for your comment.
Monique, would you like to unmute and say a little more about how you're thinking about that?
I can be brief. I see a hand there. Yeah, I don't think trading your health for money is a good idea. There's circumstances under which there should be no work going on, and people should not be exposed to harvest and to irrigate. When you talked about the livestock pass, it sounded like there were folks who were willing, they may be the operator or the owner, and they were really willing to risk their health to rescue their livestock and I suppose their business and their livelihood. But this is a case of employers risking the health of workers because they want to irrigate and harvest crops. And there has to be a point where there cannot be work in 100-degree heat and workers should be paid. I presume the only because it's a pass, but it's a pass into a hazardous area that will compromise your health. And I presume the incentive is because you don't want to lose your work. And I think unemployment, disaster unemployment, and like I said, even insurance for the growers who might lose their grapes or whatever, I could tolerate more than risking health for capital. So that's just my 2 cents.
I completely agree, Monique. And one thing I really want to highlight that you brought up is that you're exactly right, that the intention of this program, again, was for livestock originally, and also for managerial level employees who have working knowledge of the operation and could quickly enter and exit the area. We have talked with the California, sorry, I'm forgetting the acronym, California Family Farms. I'm forgetting the acronym off the top of my head, but essentially that there are some, 1 or 2 person operations in Sonoma that are growing diversified vegetables, often organic, et cetera, and that they have really enjoyed and appreciate the Ag Pass program again, because if you're an owner and you're able to go in and really quickly turn on the water for irrigation or something like that, they feel that that's something that should be allowed. But again, the intention of this program was never really kind of non-managerial level positions like this.
Thanks. And Jenny, I see you have a question.
Yeah, I have a question, but I'm not sure, Carly, if you dug deeper in that direction. But you commented in passing that folks have been really hesitant to enroll in Medi-Cal. It's been a stepwise expansion, so some people have been eligible for a while. So I think it was 2020 for young adults, and then 2 years ago for older adults. That's now for middle-aged adults. So how do you? Well, I'm curious of 2 things. Like, is there primary hesitation, a fear of disclosure because of their immigration status? And the second question off of that, how do folks deal with that? And you might not know, but how do they deal with the health conditions that they're experiencing post wildfires if they're not getting access to medical?
Yeah, great questions. I'm working with a few groups in Sonoma as well as Ventura and other areas of the state, and we really have heard, the fear of signing up for programs like Medi-Cal impacting the ability to get documentation as one of the most widely cited reasons for not signing up for Medi-Cal. I think also just, again, general fear of government entities and not a lot of kind of like hands-on assistance in, again, more rural areas to actually sign up for the program. In groups that I've worked with more in Southern California, a lot of individuals say that they're more comfortable going back to Mexico to get health services versus accessing health services here in the United States. And then in terms of your second question of how individuals are addressing health symptoms, they're essentially kind of just dealing with it and going back to work and continuing to work with those health symptoms.
Thank you. Yeah, I think it'd be really interesting in the longer term as like FQHCs change their operation with the expectation that a lot more people have Medi-Cal, which is true that a lot more people will, but there will be this persistent group of people that have no insurance, and how they kind of change their operations considering that persistent population that will need some care. I mean, obviously the best solution would be to encourage uptake. But yeah, that's difficult, I'm sure. Thank you.
Yeah, thank you.
Thank you. There's 2 questions from Pritika in the chat. Are there any recorded statistics on the number of animals saved through this initiative? And secondly, have there been any formal concerns or protests raised by farm workers, animal welfare advocates, or related organizations regarding the safety and effectiveness of the program?
So for the first question, I'm not so sure. That's not really been the focus of my work. It's more specifically farm worker health. For the second question, there have been a lot of concerns raised. And so, like I said, last year, almost exactly a year ago in September 2023, the Sonoma County Board of Supervisors officially amended the program to include harvest. And there was a lot of public comment at that time from, community-based organizations, farm workers themselves, farm worker advocates, et cetera, regarding the lack of health protections for the program. And yeah, the amendment still went through. In terms of the question from Claire, how does the required fire training and the Ag Pass acquisition process improve health outcomes for farm workers? So this is kind of one of my key points, is that it's not a health training. It's just a fire safety, kind of physical safety training. And so I think both at the county and state level, health training needs to be included in this, again, in in concert with local community-based organizations and federally qualified health centers, et cetera, and those who are, you know, trusted entities and have experience delivering this information in culturally relevant ways. Right now, the language is that, you know, the training cannot be more than 4 hours, but there's not really regulations regarding the minimum length of the training or specific topics that need to be covered. Yeah. Yeah, Nestor?
Hi, Carly. Thanks for the presentation. I was curious, and I'm sorry if you mentioned this already in your presentation, but what is the role of like the Farm Bureau in relation to this? And can you speak a little bit about like also maybe the role of the public health department in the county? What is their level of involvement, and what keeps them from being more involved in this process?
Yeah, so for the former, I don't know that I have a great answer to that other than at the state level. Entities involved again in livestock were very supportive of the livestock bill. And again, I think a lot of us can agree like that's pretty reasonable that if there's a fire and an owner wants to go rescue livestock, you know, that's their decision. But in terms of the ag pass, I haven't been as plugged in on that side. In regards to the Department of Public Health, you know, those are kind of questions I'm still working on answering right now myself. The health director, there are two kind of positions quite high up in the Department of Health in Sonoma that have resigned or left in the last like 2 months. And yeah, there is an Office of Health Equity in the Department of Health, though, that we talked to recently, and we're really trying to kind of understand, you know, is there a space and opportunity for health to get more involved here? And again, that kind of goes to the recommendations of looking at like AQI levels and heat levels in the evacuation zone in nearby areas to ensure that it would be safe to enter an evacuation zone. But they have not thus far been included formally in any way really in the activation of the ag pass.
Thanks.
Thank you. Any other questions? I know we're almost at time.
Carly, just a note that I do have the hospital and mortality data for the state if you want to chat about that.
That have occupation?
I don't think it has occupation, but we could talk about ways to get closer to your population of interest, perhaps. But nothing as great as a field that says occupation.
Yeah, I'll follow up with you.
Okay.
I've talked with Becky Stager in HPM a little bit about this, and it's like we just need a data set that has occupation and hospitalizations and everything. But yeah, I'll follow up with you.
Great. Well, thanks so much for sharing your work with us today, Carly. I really appreciate it, and hope everybody has a good day and stay cool. Take care. Bye-bye.